My topic is information processes in modern medicine. Now, I basically deal with a lot of chronic complex wounds. So when we actually establish this kind of processes with proper information technology and smartphones technology and all that, it helps to actually cut down the time, cut down costs, and we also are able to assess patients better. Okay, I think when we move into the modern era, there is a paradigm shift in modern medicine, especially in the assessment, management, and also in follow-up. So nowadays we find there's a lot of newer information technologies, there's artificial intelligence, all that. So in my thesis, I had the distinct pleasure and honor of actually doing a study comparing advanced wound products against traditional and conventional products. And we found the advanced products, actually you don't have to do dressings every day. You can actually do it maybe twice or 3 times a week. You cut down the patient coming in, so you cut down a lot of costs and also the hidden costs. At the same time, it improves the healing time, it improves the healing rates and minimizes the complication. The second aspect is looking at digital app. So we actually use the digital app to show that, you know, when you take photographs of wounds, you can measure the length and width and the area and the whole volume itself. You find that you actually increase 500% in terms of productivity, and you cut down about 20,000 euros per nurse per year. So that is a huge advance basically in modern medicine, because it's now cost effective, easy to store the data. It all goes to a single app with a single program. So this too is important. And we also looked at the multidisciplinary approach. That means basically having different clinicians looking after the patient with more patient-centric care, and also helping them with their health-related quality of life and pain and all these things. This program basically got a good structure is we have got good support from the teams at UEarth and the PhD Club. And at the same time, basically I was able to actually cover about 30 health clinics looking at advanced wound management and do a lot of digital work basically. So at least we have got an app which has been expanded, and we hope to expand on the app even more for more other applications, maybe even thermographics and all that. So this process was quite good. It was a learning experience. It made me go through a lot of research and methodologies, and I think now looking back, once you finish it, you feel happy. I think one of the most important things is, first thing is, age is not a limitation. You can do your PhD at whatever age. And even though this is my second PhD also, it's still, you feel nice like being a student back again, you see. So much lesser responsibility compared to being a full-fledged physician. But the other aspect is also be passionate about your work. You need to specialize. So you need to specialize and super specialize. So when you do a PhD, you are actually getting more information into that particular field, and you will be the resource person. So to come to that level, basically, it's good to do, because paper qualification is very important, and the journey itself is important because you collect a lot of data, a lot of information, and finally, you are much better. It enriches your life.